Lying down, adrenal sign. This is a longitudinal section across a fetus with bilateral renal agenesis. This is the spine. This is the ribs. We see no amniotic fluid around, and this is the adrenal, which lies longitudinally on the psoas muscle, and no kidney here. These are the small bowel loops, spine, adrenal gland, aorta. This is the lying down adrenal sign. This is the adrenal gland with hypoechoic peripheral cortex and echogenic inner medulla. This is the adrenal gland. Bilateral renal agenesis. The lying down adrenal sign is a cross-sectional imaging sign of renal agenesis or ectopia. In which the ipsilateral adrenal gland appears to be lying down on the psoas muscle posteriorly. This is a coronal section across this fetus, and here we see the abdominal aorta, and this is the bifurcation. We don't see the renal arteries, which should arise perpendicular to the abdominal aorta on each side. This confirms bilateral adrenal agenesis. Here we see both adrenal glands in cross-section. This is the right adrenal gland in cross-section, and this is the right adrenal gland in longitudinal section. The lying down adrenal sign can be a useful sign to confirm renal agenesis when the kidney is not visualized on antenatal ultrasound, as in this case of bilateral renal agenesis. This is the right adrenal, and this is the abdominal aorta, and this is the bifurcation. These are small bowel loops. This is the adrenal gland, and this hypoechoic structure here is the psoas muscle. Near the spine. This is a transverse sweep across the fetus. We see here the right and left adrenal glands with absence of both kidneys. This is the head of the fetus, and we see anhydramnios. This is the heart. Because of the linear shape of the adrenal gland in this situation, instead of the Y shape, which is the normal shape of adrenals, it is also described as discoid or elongated or pancake adrenal gland. Also, it could be called the straight adrenal gland. No renal arteries by cross-section of the abdominal aorta. This is the right adrenal gland. The fetus is about 19 weeks, anhydramnios and bilateral renal agenesis.